Ovulation usually happens on day 14 in a 28-day cycle. So if your cycles are a longer period, like 30, 35 days, it will happen 14 days prior to the expected date of menstruation. The egg that gets released survives for 24 hours. Once it is released from the ovary, it enters the tubes, waits there for 24 hours. If the sperms are able to reach this egg, it gets fertilized. If not, it will get absorbed. So how do you know when are you ovulating? One is, of course, if you have regular cycles, you can fairly accurately calculate that this is the time that ovulation is likely to happen. So if you want to plan a pregnancy, you start trying from day 10 onwards till day 20 with a minimum of alternate day relations. If you have irregular cycles, you can track the ovulation by different methods, like using the ovulation kits. The ovulation kits actually tracks the LH surge, which happens just at the time of ovulation. So you can use that and find out when you are ovulating. Other methods are using the calendar method. That means track the ovulation for 5 to 6 months and you get to know exactly at what time ovulation is happening. You can also check the cervical mucus. The quality of the cervical mucus changes as ovulation happens. What was thick before becomes thin and watery post-ovulation. Another method of finding out is by checking the basal body temperature. Now this has to be checked first thing in the morning, before you leave the bed, before you start eating or drinking. If you find a 0.5 to 1 degree rise of temperature, this happens at the time of ovulation and afterwards. So these are the ways to track ovulation. Nowadays, a lot of women are using the ovulation kits, which are fairly accurate. But if you have regular cycles, you know you can go through that phase of day 10 to day 20 and try correctly if you are planning a pregnancy.